Thank you for joining us for today's webinar, Working with Justice-Involved Youth. My name is Marla Kaufman, and I'm the Communication and Health Promotion Associate at IRETA. I'll be moderating our webinar today. I would like to go over some quick housekeeping items about how to use the WebEx technology and how to access continuing education credits. First, we would like to encourage you all to participate in today's webinar in a few ways. If you have questions for our presenter or are experiencing any technical issues, please use either the chat function or the Q&A panel to communicate your questions. Our presenter, Dr. Nora Charles, will take questions at the end of the webinar. Feel free to submit your questions through the chat or Q&A box at any time. This webinar is approved for one PCB and/or NADAC credit, which is free. A certificate of attendance will also be available to download from your MyIRETA account. Please take note that it will take up to 48 hours for your CEUs and certificate to be available in your MyIRETA profile because we have to cross-check your attendance with WebEx following the webinar. After the webinar, you will receive a follow-up email. This email will include a link to an evaluation form for the webinar, as well as more information on how to access your certificate of attendance and continuing education credits. We may send you an additional email to remind you of the evaluation. I would now like to introduce you to today's presenter. Dr. Nora Charles is a licensed psychologist and associate professor in the School of Psychology at the University of Southern Mississippi. She earned her PhD in clinical psychology from Texas A&M University and completed an NIH-funded postdoctoral fellowship at the University of Texas School of Medicine. Dr. Charles teaches courses on psychological assessment, adolescent development, and forensic psychology. She also supervises PhD trainees completing clinical psychology, practicing in both forensic and general clinical settings. Dr. Charles and her students engage in community-based research on prevention and intervention strategies for at-risk and justice-involved youth. This work is currently funded by the Health Resources and Services Administration, the Substance Abuse and Mental Health Services Administration, and the University of Southern Mississippi. Okay, Dr. Charles, if you are ready, I will hand things over to you.
All right, thank you. Well, thanks everyone for being here with me today. I'm excited to talk about working with justice-involved youth. This is one of my favorite topics, so I will just jump into things. The plan for today is that we will be, sorry, I want to make sure you guys can see everything and I'm not accidentally blocking a slide. Okay, technical challenges. So our plan for today is that I'm going to give you a little bit of information about the juvenile justice system in case folks are a little unfamiliar with how that works. Then I will talk about correlates of justice involvement for kids, and I'll talk about working with kids that are in the justice system and strategies that may be helpful, barriers that could be faced, and what the evidence says about the best way to work with these folks. So to start off, the juvenile justice system contains about 2 million kids under the age of 18 each year who are arrested in the United States. Over half of these kids, about 57%, are placed on probation as the ultimate outcome of their legal situation. Almost 90,000 are incarcerated in a detention facility as a result of their legal involvement. Many kids in the justice system are processed through youth court. This is a special court docket for kids who are under 18 who are not being charged as an adult. Adolescents who are in youth court can be sentenced to the same kinds of things that adults can. So they may get community service, they may be placed on probation, they may have to pay restitution for things like property damage, and they may be placed in detention. Some kids will be charged as adults, so they will be called JCAs or juveniles charged as adults. That means that they do not go through the special youth court process and youth court judges, and they will go through the adult system and potentially be detained in adult jails or prisons. Looking at who is involved in the justice system, justice-involved youth are nearly 3/4 male, more than 50% people of color, and about 20% LGBTQ identified. So these are three groups of folks that are overrepresented in the juvenile justice system relative to the general population. Many kids in the justice system also have low school achievement and histories of things like truancy. So they have school-related problems academically as well as potentially behaviorally. Most justice-involved kids are between the ages of 13 and 16, and the most common crimes that they are charged with are either person, like assault, or property, like breaking and entering, types of crimes. Looking at outcomes for these kids, recidivism for youth under the age of 21 going into early adulthood is fairly common. It is not unusual for kids to end up having more than one charge. However, most kids will decrease or stop their illegal activity entirely during the first 3 years following their encounter with the justice system. So the overall picture for justice-involved kids is not that they are highly likely to continue a long-term criminal activity-related lifestyle through adulthood. Most kids will not have that persistent kind of involvement with the justice system. The kids who are more likely to reoffend and to continue to have contact with the justice system are kids that have some risk factors, things like engaging in substance misuse, needing services like maybe mental health or substance-related services and not receiving those while they're in contact with the justice system, or having the services they receive be of low quality or somehow not appropriate for them. That means their needs aren't being met, they're not really being rehabilitated, and they're more likely to continue with behaviors that can cause justice system involvement. Kids are also more likely to reoffend when they have poor academic achievement. So if they're not doing well in school, they're operating behind grade level, things like that, those are risk factors for continued justice system involvement. As far as the impact on the kids who get involved in the justice system, we know from a lot of research that there are a host of negative outcomes that these kids are at risk for. That includes difficulties obtaining and maintaining employment into adulthood. So there's a lot of studies showing that they'll have trouble having, stable professional careers later on. They're also more likely to engage in health risk behaviors, and as a result of that, to have poorer health. So things like smoking, risky sexual behavior, other kinds of substance use that can have physical impacts on them and lead to health conditions down the road. Then lastly, any involvement in the juvenile system is associated with adult involvement in the justice system. So most kids will desist their criminal activity and not continue to have that problem into adulthood, but having any juvenile involvement does increase your risk for adult criminality relative to kids who did not have encounters with the justice system while they were adolescents. So then we have this question of, knowing that there are all these kids involved in the justice system, knowing what the potential negative impacts are there, why do kids get involved in the system? What kinds of things maybe could predict this that might be points of intervention or prevention for behavioral health professionals? The first thing I want to talk about is actually biological risk factors for justice system involvement, something that we can't necessarily always intervene on, but that I think is helpful for professionals working with these kids to know about. First of all, I think it's important to understand adolescent brain development in a general sense. So all adolescents are going through a developmental period where their brain is changing, and the way that it changes and the kind of order in which things change can actually help explain some adolescent behaviors that could lead to contact with the justice system. This is something that is true for all adolescents and may help explain the behavior of adolescents in general, the majority of whom are not going to be justice involved, but can help us kind of understand this age group. The two things that I really want to highlight are two brain processes that are occurring that are impacting adolescent behavior. The first thing is, before adolescence, your limbic system, which is an interior system in your brain, is pretty much mostly developed by the time you enter adolescence. This means that your sense of reward and the areas that control emotional response and areas that help you, know if something is exciting or something feels good, those are all pretty well developed. In contrast to that, your prefrontal cortex up at the front of your brain, that actually doesn't mature until adulthood. And this is important because the limbic system is telling us what is fun, what feels good, what we like, what makes us mad. That's all on board. And the things that might help us think through consequences, plan our behavior, decide whether something is a risk that's worth taking, those parts of the brains really aren't fully functional yet. I like to use the analogy of a car, where adolescents have the limbic system that is like the gas pedal that is floored, but they don't have really good brakes in their car. Their prefrontal cortex is not there to kind of stop the ideas that form in their limbic system from leading to potentially problematic behaviors. So what this looks like in terms of kind of personality and a way a kid might present is that for all adolescents, not just justice involved kids, we see some higher levels of impulsivity than we typically see in adults. So impulsivity is kind of nicely characterized by this Dennis the Menace cartoon. Dennis is here in timeout. He's saying, by the time I think about what I'm going to do, I already did it. So that's what we see with impulsivity, doing things without really thinking. Of course, there are individual differences in impulsivity across kids and adults, but there are also developmental differences here, where we see more impulsivity earlier on in adolescence before their prefrontal cortex is more matured and able to exert more control over their behavior. The other process we see developing during adolescence is sensation seeking. So that is seeking out exciting new experiences, thrills, things like this guy who's skydiving. So this is something that is coming from your limbic system, telling you to kind of seek out something that looks interesting and exciting. And there are individual differences in this as well. People vary in terms of how sensation seeking they are as a person, but there are developmental differences as well that are important during adolescence. So to illustrate what typical development looks like, the orange line here is your impulsivity level. So you'll see it actually starts out high and gets lower during adolescence. When you are in pre-adolescence or childhood, you are more impulsive than you're going to be when you're older. And that's why we have to watch kids. You know, they make bad decisions, blurt things out, jump off something that's too high. They're impulsive. So that gets better during the course of adolescence. The other thing that is happening is that blue line, sensation seeking, is increasing and really peaks over the lifespan during mid to late adolescence. So we have folks where your sensation seeking is going up, your interest in those new exciting activities, new people in your life is going up, and your impulsivity is still pretty high developmentally. You don't have adult levels of impulse control. So there's this vulnerable period in adolescence where your foot is on the gas and your brakes don't work so well, using my car analogy. And that's why we see a lot of problem behaviors and things that seem kind of dumb to adults happening among adolescents. There are individual differences in how these processes develop, just like how your brain develops. And so this is a depiction of kind of typical development, but there are people whose impulsivity never really gets that low, or their sensation seeking is extra high compared to other people. So depending on how these processes are developing, you may get behavioral outcomes that are relatively more extreme in some kids. There are a few other biological risks for delinquency that, for the most part, we can't do anything about, but I think is important for professionals to know. So one of those is male sex. So just being male increases your risk for behaving in a delinquent manner and getting into contact with the justice system. The remainder of things on the slide here are all things that impact brain development in a negative manner. So they may lead to things like your impulse control never develops as well because of the impact on your brain that these kinds of things have had. Those things are exposure to substances when they're in utero, poor prenatal nutrition, birth complications that impact oxygen to the brain and things like that, exposure to lead in childhood, and head injuries occurring in childhood or adolescence. All of those can increase someone's risk for engaging in the kinds of behaviors that might put you in contact with the justice system. Moving on from biological risk factors, we have social influences on kids, and there's a lot of those. One really important one is the kid's family. There's a lot of research on how parenting strategies relate to rates of kids' delinquency. A meta-analysis that pulled together data from 161 studies on this topic, so it's a really nice overview of what the literature collectively says about this, found that there's two main points to keep in mind. The first is that negative parenting behaviors, things like neglect, hostility towards your kid, rejection of your kid, those are all positively associated with delinquency. Parents who are doing these things, the more they're doing them, that is associated with more behavior problems in the kid. The other main thing that emerged from this meta-analysis was positive parenting behaviors also have an impact. So parents who more closely monitor their kids and supervise them, know where they are, who they're hanging out with, those kids are less likely to engage in delinquency. So here we have ways that parenting can both exacerbate and lessen risk for delinquency in kids. When we talk about parenting, I think it's important to talk about parenting as really this bidirectional relationship. It is not the case that parents are choosing to act in a way that maybe isn't optimal strategies for parenting, and they're just making their kids out to be a certain way. Parenting really starts with the kid that you have, and some kids are harder to parent than others. So the child may be a difficult to parent child. They have a challenging temperament. They're not very responsive to consequences. They're displaying more difficult behaviors than other kids are. That can then lead to parents using disciplinary strategies that are kind of reactive. They get frustrated, or they, don't know what works, and they're kind of inconsistent about applying different kinds of consequences, and maybe harsher in their punishment. They may also withdraw from their kids a little bit and be less involved with their child because they find interacting with their child to be kind of aversive. Those things can then lead to even poorer behavior from the child. So we have a cycle here where the child is hard to parent. The parent maybe doesn't choose the absolute best parenting practices all the time. Kids' behavior gets worse, parenting may get worse, and it kind of keeps going like that. It's also important to note that most of the time, parents and kids are sharing a lot of genetic material. So parents who maybe aren't the most self-regulated people, are a little more emotionally reactive, they're likely to have kids that share some of those traits. So then you've got two people that maybe aren't the best at conflict resolution or calmly managing things that aren't going well, kind of feeding off each other, and things getting more challenging in that parent-child relationship. Thankfully, we do have some solutions for this. So parent training programs are evidence-based programs that are effective for a variety of conditions, things like ADHD, oppositional defiant disorder, disruptive mood dysregulation disorder, conduct disorder. They're also effective for preventing delinquency, as well as potentially changing the course of delinquent behaviors and as an intervention as well. In parent training programs, parents are learning to respond more effectively to kids' behaviors than what they have been doing. Usually it's very behavioral in nature, focusing on using praise and positive rewards for good behavior, and then consistent consequences for negative behavior, which includes things like punishments, but also things like ignoring behaviors that maybe a parent is used to reacting to, but are not particularly dangerous. And if things get ignored, a lot of times that behavior extinguishes. That's a basic behavioral principle. So some examples, I'm not going to read this whole slide to you, but these are just some examples of parent training programs that are evidence-based programs that are likely to be beneficial for kids who are in the justice system. So if you have pretty young kids, the first two options may be good go-to treatments. PCIT and PMT are both things that are really elementary and even younger kinds of kids. The incredible years is parent management training that occurs in group format. So depending on, the resources available or the type of setting you're working in, this would be bringing a group of parents together to talk about all of their parenting. Then Triple P and Defiant Teens are programs that can be used with older kids. So if you're really focusing on the more kind of typical justice-involved kids that are teenagers, those may be the most beneficial programs for kids in that age range. Another influence that is an important context for kids is school and their experiences in the school setting. School engagement is pretty important. We know that disengagement from school, so not putting in a lot of effort, not feeling like you belong in school, not really being motivated for academic success, that can start very early in a kid's journey through the school system, as early as first grade. So kids who maybe are struggling academically or behaviorally can get kind of turned off school. And that's important because school disengagement is a central developmental process that underlies things like school failure, dropping out prematurely from school, that can have long-term consequences for kids that are not being very successful in the school setting. In terms of delinquency, there's also research showing that people who are engaged in school can have that act as kind of a protective factor. When there's life stress occurring in a kid's life, we can't always change the things that are stressful. But if those kids are engaged in school and getting something positive out of school and having successes in school, that appears to moderate the impact of the stress on the kid's risk for delinquency. Meaning that even if two kids have the same kind of stress, if one of those kids isn't really engaged in school and the other one isn't, the one who's more engaged in school is less likely to have contact with the justice system and engage in delinquent behaviors. So it's important that school engagement be encouraged as this kind of protective factor for kids. I think it's important to note that there is some disagreement about the exact direction of effects between school engagement and delinquency. And I think both sides are probably true for different kids or at different times for an individual kid. So the first idea is that school engagement is what is predicting the kid's delinquency. Kids who don't perform well in school or they feel alienated at school, they're more likely to seek out other ways to get their needs met, other ways to, find success or friendship. And that may be through delinquent peers and delinquent behavior. The other side of that is that delinquency can also predict school disengagement. So if kids' delinquent behavior is causing peers to reject them, if their behavior is leading to exclusionary discipline, like they're being suspended from school, if they're getting negative feedback about their behavior from adults in the school system, that can mean that their delinquent behavior is actually causing the disengagement from school rather than the other way around. So like I said, these both can be true, kind of depending on the specifics of the situation. The school to prison pipeline is something that I'm sure folks are familiar with. A really brief summary of this is that there is an issue with kids being funneled out of public school system for disciplinary issues and into the justice system. And the problem is that a number of these kids who are kind of pushed into the justice system from schools are from minoritized racial or ethnic groups or are disadvantaged in other ways, like, for example, kids with disabilities. When kids have their discipline issues that used to be handled in the school setting instead turned into a criminal matter, this diminishes the kid's ability to be academically successful, often because of things like not being in school, going to alternative school, going to detention, and also it diminishes their school engagement, right? They've had this bad experience at school and they're less likely to feel engaged with school. Going from school into the justice system because of school behavior issues is also associated with continued justice system involvement and recidivism. So just like with parenting, thankfully, we do have some solutions here. If folks are working with schools at all, it is possible to kind of consult with schools and encourage schools to do things that we know can help prevent kids from being in the school to prison pipeline. And that's things like looking at the discipline practices and outcomes in a school and analyzing whether there are disparities. So are kids of color or kids with disabilities being disciplined differently than kids of other identities? Schools can also implement school-wide positive behavior interventions and supports. So PBIS is a school-wide intervention that tries to promote a more respectful, positive school climate for everyone. It reinforces positive behavior and pro-social behavior and tries to focus on that less so than discipline and control over the kid's behavior. Even if you're not working in a school system or really having influence over a school, you can still incorporate what we know about school engagement into your work with individual kids. So for example, research has shown that among juveniles who were incarcerated, so potentially more serious offenders, those who became involved in school and engaged in school after their incarceration, and those who had more academic success were less likely to have recidivism, continue to be delinquent later on, than kids who showed disengagement from school after incarceration. So we can encourage kids to get engaged in school or to work with schools to get whatever supports the kid might need. If maybe they need some help through special education, things like that, that could help them be more successful and hopefully prevent delinquency as an additional outcome. Beyond families and schools, there are other aspects of the social environment that are related to risk for delinquency. So peers are obviously very important for adolescents. Adolescents spend more time with peers than parents. In a typical weekend, an adolescent will spend probably twice as much time with people their age than they will with their families. So it's a lot of time with their peers, as well as time they may be spending in school. Some adolescents will actively seek out deviant peers, peers who are engaging in problem behaviors or delinquency, because maybe they find that exciting, or they're not fitting in with more pro-social kids at school, so they're looking for alternative friend groups. And when they seek out peers that are actively engaging in problem behaviors, they're more likely to do that themselves. But kids don't have to just seek that out to have that influence on them. They will be influenced by peer delinquency, even if they're not trying to make friends with these kids that are getting into trouble. If there's kids in their neighborhood or their friend group or their network that are engaging in delinquent behavior, that also increases the risk that they themselves will do that. You can think about the movie Grease, which I realize is a little bit old reference, but at the beginning, Sandy's this real goody-goody, and then she makes friends with these kind of mildly delinquent kids in the high school setting. And by the end of it, she's much more like them than she was like herself at the beginning of the movie. And that's the influence of peers on her behavior. One obviously kind of extreme peer group that is particularly detrimental would be a gang. National estimates show that over 400,000 adolescents join gangs every year. It is estimated to be about 10% of the adolescent population. The average age that a kid joins a gang is 15 years old. So, freshman, sophomore year of high school is the typical age. Although I have known kids that have jumped into gangs as early as elementary school. So certainly it can be younger than that. The prevalence of gangs does vary some by location, but maybe not in the way you think. People tend to think of gangs as being kind of an inner city issue, but actually the rates of gang involvement in large cities is lower than in smaller cities or in rural areas, which actually have the highest rate of gang involvement. I'm in South Mississippi, and this is something that surprised me when I started working with kids in my local area, that there were a lot of kids from some of our very rural counties that were gang involved. And I really hadn't realized the extent to which that was part of the social environment in these rural areas that are not, kind of the popular culture image of what gangs are like and where they are. Beyond peers, there's also an influence of neighborhoods on kids' risk for delinquency. So neighborhood disorder, crime in the neighborhood, that can reduce kids' feelings of safety and kind of make them feel uncomfortable and anxious in their environment. Neighborhoods where crime and delinquency is taking place can model that negative behavior for kids. They're growing up, they're trying to kind of think about who they want to be and how they want to behave and what's normal, what's acceptable. And so if they're seeing a lot of folks engaging in problematic behaviors, they're more likely to follow that path themselves. In some neighborhoods, there's also issues with community violence exposure. So this would be, out in the community, unrelated people getting into violent altercations, shootings in the neighborhood, things like that. Community violence exposure increases a kid's risk for delinquency as well as other kinds of mental health outcomes related to potential trauma exposure. Collectively, this experience of kind of problems in the neighborhood and violence in the neighborhood and low safety are thought to contribute to kids' sense of hopelessness about the future and give them kind of a restricted view of what may be possible for themselves. If what they're seeing is a lot of folks who are living in poverty and getting into contact with the justice system and having these problems, they may feel like that is kind of an inevitable outcome for them and therefore not really be motivated for doing things that are more pro-social, like focusing on academics, thinking about a career, thinking about college, things like that. Once again, here we do have some solutions. So at an individual level with a specific kid or family, we can talk about engagement in pro-social activities. Those can be things that are explicitly pro-social, like having the kid do volunteer work. They can also be things that just aren't antisocial. So encouraging kids to get involved in things like sports teams or other community activities that will give them something to do, probably provide some amount of supervision, and also connect them to peers who are interested in something beyond the kinds of negative behaviors that more delinquent kids may be engaged in. Mentoring programs vary quite a bit, and there's kind of mixed results from them based on the variability that we see in how they are implemented. But generally, I would recommend kids finding a mentor, especially if they're at risk for justice system involvement or already involved. This would be a caring adult from outside their family, outside of a role where they're really in charge of disciplining the kid, someone who's in a good position in their life and can give advice and kind of show the kid what a different potential outcome for their life is and encourage them down that path. And then, of course, we can work with parents, like I was talking about when I mentioned parenting, about increasing monitoring and supervision so that we can try to keep better tabs on what kids are doing and prevent delinquent behavior. The next set of solutions are really more of a societal set of solutions. So any one of us probably can't do this, but as a group, we should be making efforts to reduce community violence because that is negative for everybody in the community, to restore a sense of community for neighborhoods that maybe are, impoverished, that are not very connected socially, that are not, real positive environments for kids to be in. And then we can also, as a community, try to think about what activities are available to adolescents in our community, and are they pro-social things, or at least not antisocial things? Like, are there public parks that are safe to hang out in? Are there basketball courts? Are there things for kids to do that are safe and accessible, that give them an alternative to more problematic behaviors? So now I'll move into mental health problems in the justice system and ways that we can potentially treat those. So to start off with prevalence, we know that around 2/3 of kids in the justice system have an emotional, behavioral, or developmental disorder. So these problems are way overrepresented among kids who are involved in the justice system. It's about 3 times as likely as the general population. For intellectual disabilities specifically, so lower IQ kids, those rates are as much as 10 times as high for kids in the justice system compared to the general community. So we are seeing a lot of kids that are in need of mental health services, that are maybe cognitively delayed and maybe have different needs academically, are not as able to understand some of the things that are going on in the justice system. So I think that's really important for professionals working with these kids to be aware of. Awareness of this issue has really increased in the last 20 years or so, but in the 20th century, this was not a big part of our concept of juvenile justice involvement and why kids are involved. And so there wasn't as much attention or resources devoted to dealing with things like emotional, behavioral, and developmental disorders for this population. In terms of specific disorders, so a pretty large study of nearly 10,000 kids who were involved in the justice system found that the most common diagnosis was a substance use disorder. So about 1/3 of the kids in that study had a substance use disorder. Almost as many had a DBD, or a disruptive behavior disorder. So that's things like ODD and conduct disorder. Around the same amount had more than one disorder. That's important because having more than one disorder makes for a more complex situation. There are more symptoms to manage, there's potentially different treatments needed for different purposes, and it's a lot more risk that is imparted by more than one disorder at a time. So these kids may have depression and a substance use disorder, or conduct disorder and a substance use disorder. And it's more complicated to kind of integratively treat kids that have more than one disorder, but there's a lot of them in the justice system that have those treatment needs. This study also found that 14% of its sample had attempted suicide, which again is a higher rate than we see in the general population. And they found that although girls are underrepresented in the justice system, the girls that are in the system have higher rates of every mental health issue that was studied, every diagnosis studied, except substance use disorder, which across the board, across the population, is more common in males. But for everything else, the disruptive behavior, PTSD, depression, everything else, those rates are even higher than these when we're talking about girls specifically. That's a real high needs group. Another important factor is that justice-involved kids have more exposure to trauma on average than do kids who are not justice-involved. And there's different kinds of trauma that kids can get exposed to, so it's good to kind of get a sense of what a kid may have experienced. Their common types would be ACEs, or adverse childhood experiences. I'm sure folks are familiar with that term. Those range from things that are fairly common but still challenging, like parental divorce, to things that are less common and potentially impart even greater risk. Things like having been in the foster care system, having a parent die or be incarcerated, having a parent with an active substance use disorder. Those are all things that are potentially traumatic events for kids. Community violence, which I mentioned before, is also a potential source of trauma for kids, as is family violence occurring in their household and abuse that occurs to the child directly. Importantly, the impact of trauma and kind of the relationship between exposure to trauma and delinquency, there's this U-shaped curve where kids who have really a muted response, so they've been exposed to potentially traumatic events, but they don't show a lot of post-traumatic stress symptoms, those kids are more at risk for delinquency, as are kids who have more post-traumatic stress symptoms. So the kids in the middle are less at risk, but kids who have a lot of reaction and also not a lot of reaction are more at risk for engaging in delinquency. So it's not enough just to know that a kid is expressing PTS symptoms or not. It's important to know the trauma exposure and the PTS symptoms and how those are combined in order to understand the kid's risk for delinquency. In looking at what is typically available as far as interventions for these kinds of disorders that we see most commonly in kids in the justice system, the majority of interventions that are occurring and that are available to be selected from are individual or group therapy. Sometimes we see folks doing family therapy with justice-involved kids, but that's relatively less common than individual or group. Looking at specific interventions, there are youth-focused interventions where we're really talking about, okay, we are dealing with the kid and trying to intervene with the kid directly to address whatever kind of behavior issue is leading to justice system involvement. So one example of a youth-focused intervention is cognitive behavioral therapy, which I'm sure everyone is familiar with. So that's a big umbrella term for a lot of specific interventions, many of which are considered either promising or definitely effective with justice-involved kids. And the article that I've cited here is an article that specifically is giving an overview of CBT for justice-involved kids. So that is a good resource if you want to read a little bit about what has been tried, what the evidence says, and which specific treatments might have the most support for the kid that you are interested in working with. But generally speaking, CBT in individual format or group format is likely to be a good path to take for kids who have emotional or behavioral difficulties and are justice involved. Another treatment that is good for a lot of different things is dialectical behavior therapy, and there's a version of DBT, DBTA, which is for adolescents specifically. The citation there is for the treatment manual for that treatment. And here you have different options with DBT. You can do DBT as an individual intervention. You can do group skills training and not have individual therapy. You can do full model DBT where you're doing both of those and also doing crisis contact and things like that. Any of that is potentially efficacious and helpful for kids who have behavior issues or emotion issues and are justice involved. DBT was, of course, developed with a focus on people who are suicidal, but it is also effective for other kinds of dysregulated behavior and problem behavior. So if you have kids who are aggressive, who are emotionally dysregulated, maybe not suicidal, but self-injuring or having a lot of interpersonal problems, DBT can help with a lot of those things that may be present in a kid who is involved in the justice system. And my team currently, and for a little while now, has been doing dialectical behavior therapy skills training groups with incarcerated kids. We find that that is pretty well accepted by those kids. They tend to like it. And we feel like it is showing some efficacy as well, that it is legitimately helpful for those kids. And it's not full model DBT. They're not all in individual DBT. They come together to do the skills training groups once a week. And we've been pretty satisfied with the outcomes for that. We've also done these groups with kids who are at risk for justice system involvement in a residential placement and also had really good effects there. So I'm a big fan of DBT. I definitely recommend it for this kind of population. When we're looking at specific clinical problems, maybe you want a treatment program that is designed to deal with that particular presentation. So one thing that is often needed in the justice system involved kids is anger management. So two specific interventions, coping power and juvenile justice anger management, are manualized treatments that are designed to be implemented in group format, but with some adaptations. You could also do it on an individual basis. And coping power has primarily been trialed in boys, whereas JJAM was developed for girls specifically, justice involved girls specifically. So both of these anger management programs are designed to work with kids who have behavior disorders, who are justice involved, this type of population specifically. So they show efficacy with these kids, not just with kind of general kids, but actually with the population we're talking about, which is important because not everything translates across populations and subgroups. A need for substance use treatment is also relatively common for kids who are justice involved. So one example of that is called cannabis youth treatment, which does tend to focus on cannabis, which is one of the more widely misused substances, but can be adapted for other substances. It is also designed as a group treatment. It combines motivational enhancement and CBT together in this group treatment that is a manualized program for kids with substance use issues that has been used in juvenile drug courts and other justice-involved settings with efficacy. I have also used this program. My team had spent several years doing CYT in group setting and also sometimes individual, especially during the pandemic where we weren't really doing group therapy so much. And we found that to also be well tolerated and efficacious with kids who are justice involved and have a substance use disorder, which, as a reminder, is a significant portion of justice involved kids. I mentioned that there is a kind of overexposure to trauma among kids who are justice involved. So your gold standard trauma treatment for kids, whether they're justice involved or not, is trauma-focused CBT. TFCBT is effective in this population as well as in general population kids, and is definitely one of the more recommended interventions for kids who are justice involved and have some trauma symptoms. There is one area where we do not have great interventions that show a lot of positive evidence, and that's with problematic sexual behavior. About, I don't know, at least a couple times a year or so, I get a referral for this type of problem where the child has done some, sexually abusive behavior towards another child or is engaging in other kinds of problematic sexual behavior. And really, there is not this kind of real go-to treatment that I can say is definitely going to work for all the kids that have this kind of problem, like I can for some of these other issues. Part of the reason for that is that kids who are engaged in problematic sexual behavior are a heterogeneous group, more so than adults who are like adult sex offenders. So there's just a lot of reasons why kids are in that category, and they may need different specific treatments. But there's also not, a massive amount of research in this area either. So I think more work really needs to be done to try to demonstrate effectiveness and talk through the pluses and minuses of different treatments, specifically for problematic sexual behavior. Though I will say that multisystemic therapy, which I'll talk about again here in a second, does have some promising results for problematic sexual behavior. It is not the easiest thing to implement, but it is showing that it's potentially going to be useful for this treatment of that specific problem. You may be able to do family interventions for justice-involved kids, and that is really helpful if you can do it, because family involvement for kids in the justice system who have emotional and behavioral issues generally does lead to better outcomes for those kids. So if it's possible to include the family in your work, I strongly recommend doing that. And that might look like a couple of specific interventions. So one would be MST, which I just mentioned. Multisystemic therapy is a family and community-based intervention that was originally developed for justice-involved kids, kids with behavior disorders. So it's really designed for this population, kids with conduct disorder, things like that. And here we have an MST therapist going into the home to provide interventions to the kid and the family, going into the school, working with all kinds of different areas of the kid's life and different settings where the kid is experiencing problem behaviors, to provide this really intensive therapy program designed to change the kid's behavior trajectory and show some improvements and reduce delinquency. So I really admire MST. I think it is an excellent program, and if you have the resources to implement it, it is great. And it is not going to be feasible in a lot of settings for a number of reasons. The typical MST caseload is about 6 families that a therapist is working with. So depending on your jurisdiction, you may need a whole lot of full-time MST therapists and a lot of resources dedicated to be able to really provide this therapy with complete fidelity to the way it is intended to be done. And that represents a barrier for a lot of reasons. Another family-based option is functional family therapy, or FFT. So this is also a family-based intervention where some appointments will happen in the home, but some will happen in the provider's office. This looks at the functional piece, is how the kid's behavior is having this kind of function in the kid's life and in the family dynamics. So you're looking at what needs to kind of change in order to create different incentives and consequences and things like that for the kid's behavior by working with the family to kind of change the family system a little bit. So this is more intensive than doing some groups with a bunch of kids, but less intensive than MST, and may represent a doable outcome for situations where you can't implement MST, but you need to have some family involvement in the kid's treatment. There are, of course, a number of barriers to treatment of kids in the justice system. So one of them is identifying the kids who need treatment. A lot of juvenile justice agencies do not use a standardized screening system. They may not have very many really behavioral health trained professionals that are working in that system. And so kids get missed, and kids who would potentially benefit from mental health services while incarcerated or while on probation are not necessarily caught, which means those needs don't get met and their behavior is less likely to change. So they remain at risk for recidivism and continued involvement in the justice system. Another barrier to providing services to justice-involved youth is cost. A lot of justice-involved kids are from lower income families and may not independently be able to pay for services. A lot of jurisdictions don't have huge budgets to be able to pay for a lot of behavioral health professional support and resources. So it is challenging to be able to provide services that really meet the demand that exists out there, even if you know all the kids that need services and you've assessed that really clearly. Another issue is the availability of providers. This is kind of a specialty practice area, so not everyone has the training needed to implement these interventions, and not everyone is comfortable working with justice-involved folks. And beyond that, some people are in rural areas. So here in Mississippi, the majority of the state outside of the capital is a mental health professional shortage area defined by the federal government. So there just are not providers a lot of times, or there are not providers that have room or that take Medicaid or things like that. So even if I had all the money in the world to devote to mental health services for justice-involved kids, I might still not have enough humans to actually work with all those kids. Then even if there are enough people to work with the kids, you do sometimes run into issues related to cultural competence like we do in a lot of work. So taking psychology as an example, psychology continues to be an overwhelmingly white and female profession. And as I mentioned, kids in the justice system tend to not share that profile. So we have some cultural differences between a lot of providers out there and the families they're trying to work with. And beyond those sort of demographic differences, there's also just other kinds of cultural differences, right? So the family culture or the, sort of local community culture of kids living in different areas and different neighborhoods, where we really need providers to not just take Medicaid and be physically close enough to see these kids and have room in their schedule, but also actually be prepared to be good clinicians for the kids and be able to interact with them in a competent manner and a respectful manner that's really going to work for the families. You also run into some barriers related to justice system attitudes and knowledge related to mental health kinds of things. So folks who are in the court or correctional system may have some stigma around mental health issues. They may think of some behavioral things that they confront as being the kid being oppositional as opposed to, for example, having a trauma response. And so there's just a gap there as far as education and understanding of how mental health problems might look for kids who are justice involved and working with folks who are not behavioral health professionals. There's an opportunity to kind of educate people there that is potentially helpful. There's also the issue of mandated treatment. And what does that mean for someone's motivation and likely to be successful in a treatment? So you may think, well, if you're forced to be there, then you're not going to do as well as someone who's voluntarily seeking out help. And actually, that is not entirely true. So thankfully, for those of us that work with some mandated clients, half the battle is really getting someone in the door. And one thing that a court mandate will do is get people to show up for their appointments so that they don't have to go to detention or something like that. So if we can get kids and families to show up for appointments and at least kind of listen to stuff that we're saying, there's actually evidence that we can have a positive impact and get some of the change going in a person, even if they didn't really volunteer to come to treatment and don't particularly think that they need to be in treatment. So that's good. And then the last thing that can be a barrier that we run into is family participation. So if a kid is incarcerated, they may be in a community that is not terribly close to their home community. So there's some logistical barriers to having their family involved under those circumstances. There's also just life barriers like childcare, parents' work schedules, gas money. And then sometimes the parents have their own problems they're dealing with that make it hard for them to engage effectively in family treatment. Things like their own substance use disorder, their own legal involvement, things that may mean that involving the family is not really a realistic goal or a helpful goal. So there are solutions to some of these problems I'm bringing up. So at the macro level, big picture, I think we all need more funding for mental health care in the juvenile justice system. So call your legislators. This is something that I can't change, but I really hope changes. We need more training for practitioners and trainees in behavioral health to be more prepared to work with this population and meet their needs. And we also, like I mentioned, can educate the courts, corrections, police about mental health more, try to break down stigma and have them better understand the role that behavioral health kinds of things can play in kids' presentation. At the micro level, thinking of ourselves as professionals, what we can do, folks who are researchers like me, who want practitioners to take up treatments that they are proposing, that they're trying in their laboratory-based studies, need to think about making that accessible to practitioners. So user-friendly treatment manuals, research studies that are going to be published in places that practitioners will see them, things that are truly feasible for someone to do in their everyday practice, as opposed to something that really needs to be, in a special university clinic kind of setting. Really making things that people are willing to do and able to implement in their practice is an important step. Another thing that professionals can do is think about public scholarship when they are trying to get the word out about something that they found that's effective, talking about that on the local news, or having articles that are in publications that are in popular media. Things like that are ways to kind of get the word out there. There's also opportunities to interface with policy at the state and federal level, where researchers and providers can have an influence on the laws that get passed and things that happen. And as a researcher and as a practitioner, you can also think about engaging with the communities that you want to serve. So if you're working in the community where you live in, where you grew up, then maybe you're pretty engaged already, but some of us aren't. And so really talking to people that are in the community, that are aware of barriers, are aware of attitudes towards mental health, things like that, can help you really match what you're trying to do with what is realistic and what is likely to be helpful and effective for the people in the community. Then the last thing is that we can educate ourselves more, right? We can learn more about evidence-based treatments as they develop. We can learn about cultural factors that we may not have a lot of experience with, and try to just really be ready for the kinds of needs that clients are likely to have. Then when we're talking about our work with clients directly, working with justice-involved kids, you may need to use a lot of engagement strategies to kind of get them on board. They're adolescents. A lot of times they may be mandated to be there, so they're not the easiest customers to have, but you can engage them in treatment. You can also potentially incentivize family involvement to try to get parents more involved, which will help the kids in the long run. And you may not be able to implement full multisystemic therapy, but you might be able to implement what I call MST light, which is at least having that idea in your mind that there are multiple people and multiple systems that the kid is operating with that may be helpful for you to consult with. So it may make sense to talk to a teacher and to talk to other people in the kid's life to try to get the kid's needs met across the board, even if you're not doing full MST. As a parting note, I'd like to tell you kind of what I hope you remember from today and what you can take with you. One of those things is that justice-involved kids are still kids. When I take students into justice settings to work with these kids, that is a common comment that I get back from students, that they're just like regular kids. And they are. And some of them have done some pretty serious crimes, or lots of different crimes over the course of their short life. And they're still just kids. A couple of weeks ago, I was at the detention center and I brought in some Halloween stickers. And at first the kids were a little hesitant because these are adolescent boys and kind of too cool for stickers initially. But by the end of it, most, if not all of those kids had Halloween stickers. Some of them had them like stuck to their face, and they were totally having fun with the Halloween stickers. So they really are just kids. They like to play. They are still pretty malleable, and they respond well to things like rewards and structure. I also want you to think about how difficult it is to work with justice-involved kids and families, and to try your best to have empathy for them. They are likely to frustrate you. They are likely to have difficulty implementing strategies that you recommend. They're likely to have sort of some direct opposition. The kid might cuss you out, things like that. And that's hard to deal with as a provider. But you have to remember that these kids have tough lives, and they're only kids, and their prefrontal cortex isn't all the way developed. And having a lot of empathy for them and kind of remembering where they're coming from can help you continue to work with them and not get kind of burned out and frustrated. I also want to note that many justice-involved kids cases will break your heart. So you'll hear some horrible things that kids have been through. You'll have some kids that are not success stories that go on to, I've had kids that show up in the news down the line after I've worked with them for being charged as adults for pretty serious crimes. And that is really hard. And what you have to do is be able to take some satisfaction and sense of purpose out of the kids that you do help, and realize that a lot of the kids are not necessarily going to have completely perfect outcomes just because you've worked with them. So that can be hard. And then the last thing is that, on a more positive note, a lot of what I see with kids who are justice involved is that they have skills deficits. So they just don't have good problem solving skills, or they kind of snap to being aggressive, and that causes problems. But those are very treatable things. So they can learn skills through CBT, DBT, anger management, things like that, and they can do better. This is a thing that we can improve. So although a lot of kids may not end up in ultimately very positive situations in life, a lot of kids still will, and we can help teach them things to help them navigate life better and have better outcomes. So with that, we have a few minutes for questions, which I'm happy to take, and I can hang around for a few minutes after too, because I ran a little bit longer than I meant to.
Thank you so much. That was such a great presentation. We did have a few questions come in and some comments. One person mentioned earlier on when you were just going over statistics, they said they were really surprised by the numbers for rural areas and they weren't expecting them to be so high. Somebody said kids from high income neighborhoods involved in crime, what's the current data? And then they just gave some examples of different crimes, such as politically involved, negative behaviors, sexual related crimes. What are your comments? Thank you.
Yeah, so I can't say off the top of my head that I necessarily have data on juvenile crime in relation to income. And honestly, most of my experience is with lower income kids. So I don't know as much about higher income kids, kind of anecdotally from my own clinical experience. But I do imagine, just like we see across other kinds of social factors, that there are some differences in terms of the types of crime. And certainly, I do know there are differences in terms of how cases are handled, that kids are kind of who are already disadvantaged are more likely to get harsher treatment by the justice system than kids that are maybe from more affluent families.
And then whenever you were talking about MST and FFT, somebody asked if you were familiar with MDFT, which is originally meant for substance using adolescents. And then they said a lot of research shows it has also had good outcomes on fewer arrests after treatment. In the Netherlands, we now use MDFT even by starting when adolescents are in detention and continue it after being released with really good outcomes.
Yeah, multidimensional family therapy is also an evidence-supported treatment. So there's only so much I can fit in the slides, right? So yes, that also would be a good evidence-supported treatment for kids with the types of problems we're generally seeing in this population.
Awesome. Well, those are all the questions that came in. We're getting just a lot of positive comments, people thanking you and saying what a great presentation this was, and they really appreciate your time and how informative everything was. And I do just want to mention to the folks still on that Dr. Charles will be sending her slides over, so we'll be getting those up on the website along with the recording. But if nobody has any other questions, I'm just going to wrap up with a few quick last minute housekeeping items. Thank you again, Dr. Charles, so much for this wonderful webinar. We would like to remind all participants about the PDF of the PowerPoint along with a recording of today's presentation will be uploaded to the webinar library located on IREDA's website sometime next week. Once we have these resources posted, we will send a link to participants. I now want to remind you of our evaluation and CEU process. You will receive several follow-up emails from us. The first email will include a link to the evaluation, and the second email will include step-by-step instructions on how to obtain CEUs. Please note that it will take up to 48 hours for your CEUs to become available because we have to cross-check your attendance records. We would like to specially request you fill out our evaluation. It should take no more than 2 minutes of your time. Again, we want to thank everyone for taking time out of your day to participate today. If you have any questions at all, please email us. The email address is info@ireda.org. And with that, I will conclude today's webinar. Thank you so much. Thank you, Dr. Charles, and have a great afternoon, everyone.